Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach and director of People Beating Cancer. Welcome to the vlog post talking about Chemobrain. Essentially, the articles below talk about Chemobrain, or the formal phrasing, post autologous stem cell transplant after high-dose chemotherapy, those people with cerebral dysfunction. Essentially, it's a moderate form of brain damage, and several things. According to the studies below, Chemobrain is underdiagnosed, underreported. That's the bad news. The good news is there are people whose Chemobrain heals. Could be months, then a year or two. In my personal case, I think that my Chemobrain has improved over the past 25 years, but at this point, as a 60-year-old, it's impossible to tell what's getting forgetful, word search, executive function, focus, concentration, what you normally experience as a 60-year-old versus what cerebral dysfunction, what Chemobrain is due to chemo that I underwent more than 25 years ago. The best news is, according to research, there are therapies that help heal our brains. And in my mind, this goes double for whether it's Chemobrain or we're aging, whether you're 50, 60, 70, 80, exercise, certain foods, certain supplements, brain games help heal our brains, or help our memories, help our word search, executive function, focus, concentration, multitasking, things that I think anyone should be interested in doing, and they help. I can tell you, Brain HQ, my brain game, play it daily, and there are just exercises that I do 5-10 minutes every morning that truly helps my brain. Most importantly, Chemobrain, it's not, in my humble opinion, like most side effects, it's not all or nothing. It's not yes or no. It's not binary 0 or 1. If we as myeloma patients undergo enough chemotherapy, the brain is a sensitive organ. There will be some form of damage. How much? Really depends on the individual. So it's not as if you'll wake up one morning a year after the completion of your autologous stem cell transplant and say, oh, I have Chemobrain. It's not like that. At least it wasn't like that for me. There might be forgotten meetings, forgotten names. Facial recognition is a big one. I work on that especially, and my facial recognition has improved. I had a growing problem with seeing someone I hadn't seen for 1 to 5 years, seeing them and remembering their name. Something at 40, that would be no problem, but at 50 or 60, after high-dose chemotherapy, might not come too well. With brain games, yes, you can improve that. So, to summarize, Chemobrain is underreported. Some studies I've read estimate that over 50-60% of people who undergo high-dose chemotherapy develop some form of cerebral dysfunction. Chemobrain. Further, if we're getting up there in age, 60, 70, 80, it's not as if our brains are going to be a 20-year-old brain anymore. So the point is, you can help. You might not get back to the 20-year-old brain like you were in high school or college, but you can help. Nutrition, supplementation, exercise, sleep, that's a big one. There are therapies, evidence-based. If you'd like to know more, scroll down the page, send me an email or question or comment, and I will reply to you ASAP. Thank you for your time. Thank you for your attention. Be well.